What is obesity?
Obesity is like a pack of wolves. It's the mother of diseases.
So what exactly happens in bariatric surgery?
Now, if you just look at the data, one of the things that the bariatric surgery has done is that it has given second chance to people with severe obesity. So somebody who's 150 kilos, not able to get out of the house, not able to pursue education, not able to get married and have children, very depressed, no friends. What are the options that the society gives them? Bariatric surgery gives them a second chance.
Dr. Sarfaraz Baig, welcome to Infinite Health. Thank you so much for coming today.
Thank you, Anand. It's a pleasure to be here.
The podcast discussion for today is, I think, one of the most hottest topics, not just in India, I think across the world. And that topic is obesity, right? And I want obesity from your perspective, because I know you run an obesity clinic, and I'm very interested in what you as a gastroenterologist think of obesity, you know?
Right.
So, I mean, just to start with, like, what is obesity?
So let's start from there. Obesity basically is abnormal accumulation of body fat, right? So if you have a higher percentage of fat in your body, then one is obese. A very rough indicator would be something called body mass index. Many of you may have heard about it. It is calculated by weight in kgs divided by height in meters square. It's just a formula. And you can quickly go into Google and see it for yourself. What's your BMI? If it is anything above 25, then one is overweight. And if it is more than 30, one has to categorize these people as obesity. Another point to add is that the best way of measuring obesity, however, is a body composition analysis or a DEXA scan, where you would get exact percentage of fat in the body. So let's say if the percentage of fat in the body is more than 25%, and it would vary a little bit for men and women as well, and also from race to race. But let's say a ballpark figure for the benefit of our audience here, then one is obese. So one has to try and get down their body fat percentage less than that.
And like, what according to you would be the main cause of obesity, apart from maybe say food and lifestyle?
So let's put this a little in a controversial manner. What if I told you that it is very easy to believe that the cause of obesity is more food and less activity? And this is very appealing to human mind, because the human mind always wants a cause. But if I told you that's not true entirely, Anand, and maybe it's not even 50% true, would you be surprised?
Yeah, absolutely.
Yeah. So to get an example, if somebody is bald, their children are likely to be bald. Have you seen that? It's everywhere. So if you go to, if somebody is bald, and the plastic surgeon will ask you typically, how's your father's scalp? And if it's bald, then normally you will expect that the child will also, the male person will also be bald. So similarly, obesity is a genetic disease. It's a complex genetic multifactorial disease. So food and activity do play a role, but more like a trigger. But the gun is loaded with the bullets, and these bullets are your genes. So am I making a comparison here now? So if you have to understand obesity, you have to first understand this pistol model, that your bullets are your genes and the trigger is your food and your lifestyle. So if one has gotten the bad genes from their parents, they already have obesity and diabetes, so you inherit that. These are the bad genes. And one has a poor lifestyle now, doesn't go to the gym, doesn't have any physical activities. It's just a, chair job, 9 to 5. And you have unhealthy food, and you're also into alcohol and into sweets and into colas, then likely that these people are going to be obese. And therefore, we must try to address in each person what is the main cause, and always look at food, lifestyle, but also at the genetic component of the disease.
What I want to ask is, like, as a counter question to, what you just said, is that what is obesity associated with? Like, what does obesity cause which becomes a medical danger?
Yeah, true. So obesity is like a pack of wolves. It's the mother of diseases. So if I told you obesity can cause a problem right from head to toe, It would be surprising, but it does. Look around ourselves. Most of the diseases in current modern era are diabetes, heart attacks, liver disease, osteoarthritis, fertility issues, kidney failures. And what are these due to?
Almost everything.
These are
Obesity.
all due to obesity. So we are living in an epidemic of obesity, and this pandemic started almost about 30 to 40 years back, and we are still in this pandemic. And these diseases that I just mentioned are mostly caused by obesity. Therefore, whichever country you see, the obesity rates are high, like the USA, you will find their rates of diabetes, liver disease, and infertility. All of these disease rates are high. And if you go to another Southeast Asia country where these incidence is low, everything will be low, except for India, where we have a certain type of obesity, which is called Asian obesity, where we tend to gain weight, but mostly in the belly. So our passport photos are absolutely perfect. But if you just go down.
I think it's called skinny fat, if I'm not wrong.
Yeah, so there is a paradox called a YY paradox. There were two gentlemen, and these two gentlemen had identical BMI, but one had a percentage fat of 6-7%, and the other one had a percentage fat of 27% or 26%. I don't remember, but the same BMI, but the percentage fat was different, and that's what Indian obesity or Asian obesity is all about. Right. At a lower BMI, we tend to have far more fat percentage. And we tend to contract these diseases like diabetes, liver disease at a much lower DMI. So for us, we must be careful that we are not only looking at our BMI, but also looking at our body fat percentage through body composition analysis or DEXA scans.
So considering so many diseases that come out of obesity, what are the treatment options for obesity?
So as I mentioned, the cause itself dictates what the treatment will be. And we would typically see in about half of our patients, it's their diet and their lifestyle. And when I talk about diet and lifestyle, it's about diet which is high calorie. But remember this, and this is a paradox. When they are in their beginning phase of becoming obese, then it's high calorie. But when they have become severe obese, then there is no higher intake of calorie. It's an average diet, but still they're not able to lose weight. So diet has little to do when the patients have established severe obesity. Another thing is about physical activity. Yes, physical activity could be going to the gym, but going to the gym is not something that everybody does. Very few people will do. But what about daily steps? Just walking to your office and coming back from your office, using the stairs, not the lift. These are smaller things that if you try to find out, some people will only sit or go to the lift, go down to the car, to the office, get to the chair, and again back, and then back to the TV room. So this is the sedentary lifestyle that we are worried about. And finally is the stress. Is the stress and the lack of sleep. This is a huge component. A lot of people have a psychological aspect to it. They will tend to eat more, something called a binge eating disorder. They will do something called emotional eating. When they're sad, they eat. When they're happy, they eat. When they're alone, they eat. When they're depressed, they eat. So that's emotional eating. So in our clinic, we will always have a psychologist who would see all patients, because she's the one who is going to tell us, you know what? This patient has this kind of a background, and this is the psychogenic eating. So we will need to work on that as well. And finally, after the thorough evaluation, we'll find half of our patients are purely genetic in origin. They have largely a genetic basis. Their parents have been obese. And these patients are difficult to treat. Their pistol, as I said, the revolver is loaded with the bullets, which are bad genes. So for them, a little alteration, a casual approach to diet and lifestyle will make them obese. Once I see these patients, we will definitely get them to the nutritionist. So dietary advice is the first thing. Second is we get them into behavioral therapy. Our psychologists come next. Third is we'll get them an online trainer. I said online because I know that not many people will wake up and want to go from point A to point B. But Absolutely. They will always open their mobile. If there's somebody online training you for 10 to 15 minutes, just getting your joints in order, getting you to do some breathing exercise, getting you to move some joints and your muscles, that's enough for many of them. So getting a physical trainer to them. So that is the first component that we do for all patients. The second thing is When we are looking at a disease which is patients who have already tried this, it's not worked, it's a genetic basis, then, or if they are severely obese, which means they are like 120, 150 kilos, 200 kilos, and they need to lose fast their body weight because they're already contracted a lot of disease, like their diabetes is uncontrolled, their joints are getting destroyed, their fertility issue is there, they've been married for long but they are not consummated their marriage, or they have not had the kid, and the liver is getting worse, they're having more fibrosis, even cirrhosis. So these patients will need to get treated early. In these patients, we call for intervention. What is intervention? We'll either give them a drug, which is an intervention. People tend to think drug is safe. No, it's an intervention. Comes with side effects. We'll talk about some drugs later. We can do endoscopic balloon. We can do endoscopic tightening of stomach. And finally, there's something called bariatric surgery. It's a laparoscopic work that we do. So these are your treatment options, Anant, and it's a huge basket to offer from. The more the disease is severe, the more genetic its origin, the more chances of intervention.
So what is endoscopic balloon? Like what exactly do you do in that?
So you know that the endoscopy is a tube that we pass through the throat into the stomach, and then we make them ingest a balloon which is under anesthesia, so it is not that uncomfortable as it might sound. And once it is there in the stomach, we inflate it. So it typically becomes a 500 ml to 600 ml balloon. So that amount of stomach capacity is gone. So you're not able to eat that much. So that's how it works.
Can
but you
the
have to
balloon
remove
burst
it.
inside?
It does sometimes. You have to remove it. And sometimes nowadays the newer balloons need not be taken out. Even that is there. And newer, more modern balloons are coming up in the near future. But they give modest efficacy, like about 10 kilos, and they come back when you remove the balloon. So some of us are excited, but some of us are not excited about the balloons. But we'll see and watch that space. Endoscopic suturing has been there for the last 4 or 5 years. We've done. And we've
So
seen.
suturing means as in you staple the stomach.
Not staple. We're just suturing with threads.
Okay.
Stapling is bariatric surgery. So we'll come to that next. But suturing is you just do endoscopy and you sort of stitch the stomach from inside and make it smaller.
Okay, so if the stomach is this big, it becomes smaller.
So unlike the balloon, nothing has to be done. This is a more permanent thing, and it will give some amount of weight loss. Again, this will lead to about 15 to 20 kgs weight loss. And for some of us, this is a big thing.
And that's all you need.
And that's all you need. So that's the other intervention. And of course, the final one, which is really very effective, especially in patients with severe obesity and a lot of diseases, is the bariatric surgery.
So what exactly happens in bariatric surgery?
So it's a keyhole surgery. And the entire idea is to make holes, 4 or 5 tiny holes into the abdomen. And then a portion of the stomach is not used, is taken out. And that is the area of the stomach from where we send signals for hunger and satiety. So if that part is not there, one feels full by eating less, and they tend to eat less. However, without going into the complexity, it also changes your gut signals. So remember, I've started with the genetic thing. So the genes, what do? They basically make our signals more prominent, make patients more hungry, less satiated, decreases metabolism. And by doing this, removal of that part of the stomach, we tend to rectify those signals.
So it basically that person becomes a completely different person. Like would the genes also change in that?
No. So unfortunately, we do not have anything to change the genes, probably in the near future, but not so far. What we do is, it's like in this room, there are bulbs and there's a switch. That bulb, we are not changing, but we are
Changing the switch.
We are switching off the
Switch.
bulbs. Yeah.
So, but there's this whole conception that once you do bariatric surgery, the weight comes back. Is that true?
So we did a multi-center study. I was the first author of that study and we published it in 2019. And in that paper, what we did, we collected data from all over India, all 20 centers in India which were doing bariatric surgery, including ourselves. And we looked at our 5-year data. And we found that those of us, those patients who underwent one kind of bariatric procedure called sleeve, and the other kind of bariatric procedure is gastric bypass. In the gastric bypass, the weight regain was about 5 to 10%, and in the sleeve gastrectomy, it was about 20 to 25%. So at 5 years, you may say 20% gain weight, or you could say 80% did not gain weight.
So you're saying 5 to 10% from the weight lost. So if I lost 20 kgs, then I'm gaining 2 kgs back.
No. What I'm saying is, let's say I operated 100 patients with sleeve. 5 years later, and these 100 patients did well. They lost more than 50% of their excess body weight. That is what well means. But they sort of gained significant amount of their weight back. How many of them would be? That is 20%.
Okay, 20% gain their weight
the
back.
people who lost.
Right, okay.
So, we need to look at the denominator has to be 100. And then we look at how many people are doing well. So 80% are doing well at 5 years.
So that's fair. That's good.
Fair. And at 10 years, that may not be 20, it may become 30% may have gained more weight, but that still means 70% are doing well.
Right.
And the reason that this is important to understand that obesity is a chronic disease like diabetes. Is diabetes going to go anywhere if you give them pills and insulin? No, it's going to stay.
I think I have to say this at this point that I genuinely feel that for people who are unable to exercise and diet on a regular basis, going for a bariatric, I personally, this is my personal opinion and it might sound controversial, is because I've seen it saves a life.
Yeah.
Because they will go through 10 other diseases in the next 10 years of their life.
True.
You'd rather go through, in fact, this is a question also that I would like to ask. Like after bariatric, what is the recovery time? Like how long will you take to recover to get back to your normal life again?
If we get the patients admitted in the morning, operate them in the afternoon, next morning they go home.
Oh, next morning they go home.
It's a laparoscopic surgery. Typically, that's what happens. And I see them after a week. In a week's time, they are on liquid diet for a week, and after that, maybe about 2 weeks, they are back on their soft puree diet. They are able to join work at usually about 10 to 14 days. And in a month's time, everybody has settled down with their new system. They have understood what it is to be a patient undergoing a bariatric surgery. They get the support of the nutritionist, the physical trainer, and the psychologist right from the start so that they are able to adjust to the new life. It's very difficult to all of a sudden find out that you can't eat the entire plate of rice and you are only full by eating one boiled egg. So how's that happening? It's a miracle. But, that's what the change is all about. And I'm glad you brought that up, that bariatric surgery saves lives. I'm a little disappointed that many times people discourage others not to undergo surgery without adequate information and data. Now, if you just look at the data, one of the things that the bariatric surgery has done is that it has given second chance to people with severe obesity. So somebody who's 150 kilos, not able to get out of the house, not able to pursue education, not able to get married and have children, very depressed, no friends. What are the options that the society gives them? Bariatric surgery gives them a second chance.
Absolutely.
There's a 1% or 2% chance of having a complication, but that means that 98% patients are going home well. So this is where I think the problem lies, that whenever there's a problem with the surgical area, we try to magnify it and then we start discouraging people. And unfortunately, those people who could have had a second chance in their life are denied.
So, but what about the alternatives? Like, there are new drugs in the market like semaglutide, Ozempic, Wegovy, so many new ones that are challenging bariatric surgery. Do you think that, is it a good alternative?
So, Anant, they're not challenging surgery. They're complementing surgery.
Okay.
I think it's a great thing to have more medications. What's wrong? Let's imagine cancer surgery. So I do a fair bit of cancer surgery for the colon. If I do a colonic surgery for cancer and then send the patient to my oncologist who gives them chemotherapy for 6 months to 12 months, and these patients do better than they would have done if I had done only surgery but not given them medicine. Also, sometimes I get patients who cannot be operated. They already have liver metastasis. I send them to my friend, oncologist. He would give them chemotherapy first. And if they do well, then we take them for surgery. Also, now look at it. I've done a cancer surgery. They've undergone a chemotherapy. The patient has a relapse at 5 years. Then I send them again to my friend and he gives them more chemotherapy. Now, isn't this exactly what obesity is going to be all about?
Right.
If that can work for cancer surgery, the shift is there. The shift that has to be made is in the mindset of the society. We were looking at obesity as a benign disease, but if you just saw it as a malignant disease, you would be okay with
Absolutely. I
using
couldn't agree more.
surgery and medicine for relapses, medicine before the surgery. So that's exactly what we're doing now. I use a lot of oral semaglutide for my patients before the surgery. Sometimes we do not use surgery at all. Sometimes after surgery, when we see relapse, we give medicine. Even after surgery, 6 months later, we see that the weight loss is not great. Let's augment it. We use medicine. So medicine and surgery are all complementing each other. The more tool there are in the toolbox, the better we are going to deliver.
So I couldn't agree more because, like, as a clinical research scientist, like one thing that I've studied is called senescence. And senescence is basically when fat cells become extreme in the body, they produce something called SAPS, which is basically it creates zombie cells. And those zombie cells start eating into your body. And that's why the autoimmunity tries to eat you. So one of the reasons why most people have autoimmune disorders is because in some way they are obese.
Wow.
So most of the autoimmune disorders like thyroid, PCOD, everything comes from obesity. Because obesity is becoming zombie cells because they've overgrown. They've multiplied 50 times, now they cannot.
That's very interesting.
And they start eating the cells and your immunity starts protecting your cells. And we say that, our body attacks our cells and we can't do anything about it. So I feel like the root cause is obesity, for sure.
It is definitely a root cause for many, many ills. And I think the right way is to have many people coming together as a team,
Absolutely.
like we try to do at our clinic. And I think surgery is definitely not the front runner of the treatment. It has to start with the diet, lifestyle, behavioral approach, add drugs, think of endoscopy, then think of surgery. If the problem is severe, needs urgent attention, urgent remedy, yes, then surgery. But then the entire team has to be in place. And I think the surgeon should be the last person to see the patient.
So the average person should become the right candidate for surgery before even going for.
Absolutely.
Perfect. That makes a lot of sense, Dr. Baig. Thank you so much for this conversation. I think this is like a very good template for all the people who are looking to reduce weight to get into, because I genuinely feel there's a lot of scope in this.
Absolutely. I too agree completely that we can make a lot of difference by just making people aware of what the disease means and how it can be treated. Let them not fall prey to the fads
and propaganda. Absolutely. Thank you so much, Dr. Baig.
Thank you very much, Anant.